today's Health Watch. No goats here. We're talking about whooping cough because the weekly number of cases nationwide has just set yet another record. At least 577 reported for the week ending November 23rd. That is more than 10 times as many as 1 year ago. So with us now is CBS News medical contributor Dr. Celine Gounder, editor-at-large for public health at KFF Health News. Dr. Gounder, thank you very much for being here. Whoop, there it is. We were joking. Why so many cases?
Well, we're seeing an increase in non-medical exemptions for vaccination, a decrease in vaccination rates, and that is partly why we're seeing an increase in this vaccine-preventable disease. The other factor is that in the early 90s, there was a new version of the whooping cough vaccine that had fewer side effects, but the immunity it induces wanes more quickly. And that's also part of what's driving this increase as well.
Why do you not want to get it? What exactly? I know it's not a good thing, but to be honest with you, I don't even know what it is. I just thought it was a big, deep cough. What is it exactly, and what can we do to protect ourselves?
Is it a virus?
Yeah, so it's a bacterial infection that can linger for quite a while, oftentimes goes sort of under the radar for a while, undiagnosed. This does speak to the need when you do have a runny, stuffy nose or a cough. It is a good idea to get tested because there are specific treatments, whether it's pertussis, which is whooping cough, there's antibiotics. If it's the flu, there's Tamiflu or Xofluza. For COVID, there's Paxlovid. But you won't get the right treatment if you don't get the diagnosis.
Okay.
Is there a vaccine for children?
There is a vaccine, so this is part of your routine vaccinations, immunizations that kids should be getting. In terms of adults, it's what we call the Tdap, that you're supposed to get for tetanus, diphtheria, pertussis every 10 years. For pregnant women, it's recommended that in the early weeks of their third trimester of pregnancy that they get a booster, and that's really to protect the newborn because the newborn has an immature immune system when born. And then sometimes it's not recommended specifically, but family members, when they know there's going to be a newborn around, will also get themselves a booster too.
I remember
Talk about the
my family
flu.
got that.
Did
the
they?
Tdap. Yeah, when
I
Celine was
got
born.
mine too.
Yeah.
I got mine too. Flu cases.
Yeah.
Let's talk about that for a second because they're starting to go up, especially among kids. Why do you think that is, and what should we do about that?
Well, this is just the start of flu season. We typically do see flu cases start to rise around December. A lot of this is also being driven by the holidays, people traveling, being around family in large gatherings. In the ERs, we're seeing the vast majority of people with the flu who are coming into the ER currently are kids. So if you have not been vaccinated, this is really the time. Go out and get vaccinated now.
I got my vaccination. I knew if I didn't get it and I got the flu, Katie wouldn't care for me. So. Like, all right, I'm getting it. I don't want the man cold. Or
If that's what it takes, Tony, to
That's what
get
it takes.
vaccinated.
She would care for you, but you would just hear all about it.
Yeah, exactly.
She
That's right.
probably wouldn't. Yeah.
I did ask her directly. I was like, if I don't get this, are you going to take care of me if I get the flu? She was like, absolutely not.
She'd always care for you. Thank you, Celine. Thank you very much.